I would describe our region as a very diverse region. Diverse in a number of ways. We have, incredible wealth in our community and incredible inequity.
We are seeing such a dichotomy that we have really well-to-do, more billionaires per capita, I think, than any place else, and that we are seeing so many people that really are struggling to make it.
Access to health care has been a long-term issue for many communities.
The whole system is so broken and it's so complex and it's so hard for people to navigate.
I'm a nurse. I have a doctorate in nursing. I'm also a midwife. My husband is a physician. When we go into the healthcare system, it's intimidating for us. We have trouble getting heard.
There are so many reasons why people can't access health care on a regular basis. So a lot of people have insurance, but they don't get dental, they don't get vision. They can't afford the co-pays. I'm hearing that increasingly more. I'll talk to people who work 2 jobs.
The majority of the patients here who come here have health insurance. They just have horrible health insurance. They have big deductibles, or they may have some health insurance, but they don't have dental insurance.
The biggest reason we have as big a problem as we do in the state of Washington is because our dental safety net for adults is very poor.
One of the challenges with healthcare is it's not really a system, and so it's piecemealed, and so a lot of folks who can maybe have basic health insurance, there's really high deductible plans, so they have it in case of catastrophic illness, but they can't afford the glasses that they need.
Healthcare is so expensive now, and even plans that are affordable don't cover everything that people need.
If you don't have access to good quality health care, then obviously you're going to have those challenges down the road that will be affecting your health, your family's health, and that's going to have an impact on you and your family.
Often we make assumptions that when people are working, that they have health coverage. Or when people are living in rural areas, they're not experiencing the kind of poverty that we see in urban areas.
40% of the Seattle-King County Clinic patients were employed either full-time or to a smaller degree part-time. There are people that speak a wide range of languages. There are a wide range of ages. And they're coming from all over the state and beyond.
They have jobs. It's just the insurance doesn't cover what needs to be covered. And from ethnicity to ethnicity and young and old, that was the same story. That was eye-opening and humbling to me.
The majority of the people come do have some form of health care, but they can't afford to use it because the copay is too large. The out-of-pocket is unavailable. Their doctor will say, okay, they get in and they get that visit and that's covered. And then the doctor says, I'm going to send you down the hall to the lab. And they go down the hall and out the door because they can't afford to pay for that lab visit.
What you learn from these things is a large variety of people in our communities need this kind of help, especially dental and vision. We have veterans come in. We have active duty military, because they don't have that kind of help.
It's important to understand that a lot of the people that come to this clinic, because of the condition and disruption in our healthcare and the system itself, a lot of these people are just like us.
One of the things my husband said when he came to volunteer was, wow, these people look just like me.
There were people in our community, people that we knew that were sometimes our family, our neighbors, our co-workers, who were struggling to access health care.
You interact with people every day, but you don't know where they're coming from. You don't know who they are really. And then you see them in line.
The very first year that we were at clinic, I was doing my job, checking everybody in, and had just checked in, then looked up, and there was actually someone that I went to high school with. And standing there looking at me like, I'm humiliated and I'm so sorry to be here. This is someone who's amazing, who owns her own business, is an incredible contributor in the community that she lives in, but is that perfect example of someone who can't afford $900 to go out of pocket and pay for a mammogram. But because she owns her own business, she doesn't have health insurance.
we have folks who experience that brokenness of a healthcare system sort of every once in a while. And then there are people who feel that every day.
You see all the help that people need with food, you know, soup kitchens and food and extra help. A lot of churches and different groups provide that kind of help. Those kind of people don't have money for food, so they don't have money for...
There's just no way these people can afford to get in on a regular basis so they can protect what they have. So it develops and it develops and it develops, and then we have a key arena floor full of people and then more waiting who need the help.
When you have a healthcare need, such as cancer or a dental problem, or you can't get a job because you don't have vision to be able to see, those kinds of things need to get solved now.
There is an immediacy, so when your teeth are rotting, you can't wait for the healthcare debate to finish.
You start to think about the impact our community is experiencing because we're not meeting people's needs around healthcare.
It's no one's fault. It's the system's failure. It is a system's failure. And these folks just happen to be in the middle of that at that moment, which really any of us could be in at any time.
If you're making choices about whether you pay for this or that, sometimes taking care of yourself is at the bottom of that list when you have others that you're responsible for, or if you have other things that you have to do to make sure that you can live and survive in this world. Those are choices that in the most prosperous nation in the world, I wish we didn't have people making. We're always looking for ways that we can bring community together. And one of the challenges that I put out to our team was, how might we look at using our assets differently in a way to bring community together? How do we do things with this public place that recognizes that all of us matter?
In 2012, we celebrated the 50th anniversary of the World's Fair. And in that process, we identified some of the things that were going to be really important to this community in the next 50 years. And healthcare was one of those.
The director of Seattle Center was taken by some of the topics that had come up in global health and came to us in public program and said, you know, I am challenging you, I'm challenging us here at Seattle Center to develop and utilize our talents and our resources in new and different ways. And I'm wondering if there's something related to health that we can do.
Well, Julia Colson came into my office one morning and asked me if I had seen 60 Minutes the night before, which I had. And we both talked about this pop-up clinic that we had seen. And we started to think about, could Seattle have one of those? And what would that take? And what role could we play?
Wouldn't this be a way to really showcase kind of global health on a local level and some of the needs and where some of the gaps are and really help to elevate the conversation, but do it by also providing service?
We started by talking about how can we provide grace to those, dignity to those, service to those who may not have an avenue or way of receiving it.
It was to meet the needs of those people that needed it. It was as simple as that. If you needed medical, if you needed dental work and vision, eyeglasses, things that we take for granted, you could attend the clinic and receive that. No cost, no charges.
The thing that attracted me the most on day one, when all it was an idea between two people, was that the offering was immediate. There was no, if this, then maybe that can happen, and down the road something might grow, and then when that grows, the fruit might feed somebody and everybody's gonna benefit. It was today, it was, you walk in the door, you've got an abscessed tooth and you're experiencing pain and infection and it's affecting your whole life, and we can fix that for you today.
Our bigger purpose in mind is to serve some of our community who may be in need of help, and to bring a different segment of our community together to provide that help. The boldest part of the thing for me was that we don't know anything about what we're talking about doing. And how do we bring all these other people together to do that?
We had no experience in healthcare, which I think in the long run was a great benefit to us because we didn't know how to do it wrong. We didn't know what the pitfalls were. If we had known the pitfalls, we would have went, oh, there's terrible pitfalls, forget that. We just kind of marched in blindly thinking that we could do this.
We had no expertise in the medical community, and we had no gravitas in that community. You know, how dare you think that you can do this?
Part of the resistance we experienced was the healthcare system doesn't need Band-Aids, it needs fixing. And we didn't disagree. We were like, yeah, you know, let's go, let's fix it. In the meantime, we're going to provide a Band-Aid because people need it.
So we had our own learning to do, needing to go out and have conversations with the experts in healthcare, with the experts in who has been left out, to help develop a greater picture of what this would be or what this could be, and also to get their participation and buy-in and partnership.
This was really about this idea that you would bring a bunch of people and partners and organizations together that could use who they are and what they do to benefit the community.
I think it really created an opportunity for us to identify the many areas that we can contribute to the community.
This is just a perfect way for us to participate in that space financially, with hundreds of volunteers.
It's important for businesses and people to come together around, you know, an event like this because at the end of the day, we're all people and we're all here just taking care of each other.
People coming together with a common theme, a common desire to help, to give back and be supportive of people who are less fortunate.
Anybody is welcome to come in. You don't need ID, you don't need documentation of status, and if you're just having a hard time getting health care, this is for you. That's too good to be true. To get free dental, free vision, free medical, there's got to be a catch, and they're skeptical about it. So if we can reach people that are already trusted in these communities, and a lot of these communities have good reasons to be mistrustful.
Almost all of the initial outreach was targeted to immigrant communities, people of color, refugee communities, communities that we know have less interaction with medical, dental, and vision services.
You have to go out in the community and talk to people and meet people where they're at, in the mosques, in the churches, at community centers. That's what gets people to the party, because if you don't ask, they won't come.
We had some really great stories based on, hey, I saw it on television last night, I'm going. This is happening, it's real.
When we come together as a city to offer these services for folks, that event itself is an expression of our belief in community.
It was our community coming together and figuring out how to move this project forward and what was the best way and what was going to serve this community. So it was designed by this community for this community, and that's what I think is really spectacular about this project. One of the things that I believe Seattle Center is valued for is its neutral territory. It's not in any one part of the community. It's not meant to represent any one part of the community. It's meant to be a welcoming place for all, and I think that translates into the clinic.
Seattle Center was perfect to lead it because Seattle Center, nobody can do big events like Seattle Center. They do bumper shoot, they do folk life. Of course they can do this large scale clinic. You know, we wouldn't be able to do it. We know healthcare, but we don't know how to do this.
It's this smooth and well run and well attended by both the patients. So patient outreach is excellent, and the individuals who need to provide care to those patients, they're also really well represented. And then all the ancillary services are so thoughtfully engaged, like language service and transportation and food and all of that. It's a really impressive event.
There's so much thought given to every aspect of what is needed for people who come and need services. And to me, that starts with a team that really understands and has a strong mission and understands who they're serving.
All of the people who are working there are there to serve. They're there to do some good in some people's lives.
When you see all these faces and all these people coming in and the need and the variety of people and the variety of need and the great need, we see over 1,000 people a day. Then you want to do whatever you can to make sure people get, if you waited in line all night, we want to make sure you get your dental care. And people are committed to that.
I think a lot of people, have had experiences that have made them not want to engage with the system. And so starting with that kind of care and compassion is really important. And I think that this is somewhere where they can come and feel like there's somebody that cares about them.
There's that caring, that interaction between people, human to human. Hey, you bleed, I bleed, we're all the same in that sense. And coming together that way I think is really special.
In a private practice setting, things are different. There's a little bit of, what's this gonna cost, who are you, blah, blah, blah. And here it's like, thank goodness I'm here, and thank goodness you're here, and let's get working, right? Let's get something done.
This is an actual, not a virtual event, so put your phone in your pocket and talk to the humans, okay?
One of the things in my orientation is to remind the volunteers coming in that these people have been sitting in that tent since 11 o'clock last night, waiting for a number. And at 5 o'clock they got numbers, and at 6:30 they came in the door, and they're walking into this huge space with signs, a lot of ambient noise, and they're tired, they're hungry, a lot of them are scared because they haven't been to a doctor or dentist in years.
Our job as escorts in intake is to put people mind at ease, to make them feel welcome, to let them know how happy we are that they're here, how happy we are that we could be here for them. And it's about, from the patient's perspective, making this place feel like a welcoming environment.
This is the 5th year of the clinic, and we're in our 3rd day, and we'll be able to take you through and show you maybe what a patient might see as they arrive here. And looking upon this as kind of like a old-fashioned barn raising, where people have come together to meet the needs of a neighbor. That's who's here. You think it's going to be homeless people and addicts, but it's our neighbors who can't afford to use their health insurance.
A patient will come in and present to the front and get registered, and they get a folder, and they're asked at that time, what kind of services do you want to utilize today, which would be an option of medical, dental, or vision.
They get called over to one of these desks here. That's where we start to develop their file. We gather demographic information about them.
We register them up at the table and, get their information so that, if we do need to contact them or give them a reference or something, we'll have that in our system.
Last year we had 52 primary languages come through here. So the interpretation program is really important.
I loved the idea of providing healthcare with no barriers. I loved the idea that there'd be an army of interpreters.
It's important for that population to be able to have communication in their language so they understand what's being provided for them and what's available for them.
Doing today? Good, welcome.
So when they finish here, an escort takes them and they come right down to here to what we call patient intake. Here they sit down with a registered nurse or an EMT, and we start to take their vital signs, make sure they're healthy enough to be seen today.
They get their temperature taken, they get blood pressure taken, they get screening for rash, fever.
And then the last thing we want to do here is determine what is your biggest need today. We're not going to be able to solve all of your needs probably, but what's your most primary need that we can fix in an hour or two.
While they're here, they also realize that there's so many other things that maybe their medical insurance doesn't cover, like acupuncture or chiropractor or naturopathy.
This is the suite level of the building, and it's ideal for exam rooms. We won't go in them because they're in there doing their work, but as you walk by, you'll see on the doors what's going on inside.
In this room, we have people who are doing both wound care and foot care.
There's 135 organizations that have come together to make this work, and everybody's doing their little piece.
We have the Hope Dogs here. The Hope Dogs are wonderful for the clientele, and they do a lot in terms of just keeping people calm.
Different people have different triggers, and you really don't know what that trigger is going to be or where the dogs are needed.
If you haven't had a tooth
or teeth cleaning in many years, you can imagine the anxiety that they're feeling at that moment.
When we started investigating this idea, we knew that there was no greater need than adult dental. And it's about 200 to 225 dental professionals at a time who operate this clinic. If you've come here for vision help, you start over where we were, you go down through an area that we're about to get to where you get the real medical help you need, and then you come here to get glasses.
By having as many possible services as we can, people can get a holistic picture of where their health is today. And for the things that we don't have an MRI machine, we don't have a CAT scan, there's lots of things we don't have here. But we have social workers who can work with each individual patient based on what the providers have recommended and get them into health care outside of the stadium.
When I came to see it with my own eyes and to interact with the patients and to see the kindness and compassion, everybody is their best self in that moment.
How are you doing? Good.
That's how you earn trust. You provide the service, you do it in a dignified way, you speak to people in their own language, you tell them that that's okay and that you provide those services, and then you let them know that it was a pleasure to serve them. And they leave understanding that this is something that is authentic and this is special.
I think that the reason that Seattle King County Clinic values dignity is because it values the patient population and recognizes that that patient population is any of us. And we all deserve to be treated well. We all deserve to be respected.
Regardless of who you are, where you come from, what your past, current, or future circumstance might be, we will serve you. And regardless of the language that you speak, we will serve you. Whether or not you have health insurance, we will serve you. And I can't think of a better way of demonstrating that all people matter than to have open doors for everybody.
My eye has got a problem. I'm a farmer and I want to continue with farming. And then in future, most likely, God willing, I need to educate young guys on the importance of doing organic farming.
I heard about it on the internet, on Cairo, and then my mom told me about it. I've lived here all my life, and then you come down here and you just see people wanting to get treatment.
She needs glasses. Her glasses are broken. We don't have Medicaid or anything, so she's getting glasses.
I am self-employed. I have health insurance, but it's sort of the minimum mandated health insurance, and there's no dental on it.
I have coverage through my union, but it's not very good, and the co-pays on dental are quite high.
I worked for 30 years. I have Medicare, but I can't afford glasses, or I have to decide, do I get my medicine or do I get my teeth fixed?
I'm here today for my vision too, also to check it out, you know.
Dental. I just take the service for dental.
I have a problem with my lower mouth, and I cannot afford the dentist right now because I don't have any insurance. So I'm here to have that taken care of.
I can't afford the dental or the vision through Medicare, so it's really helpful for me.
So I went to the dentist a couple months ago to get a cleaning, and they told me I needed to get x-rays and a couple of fillings, and kind of hit me with this, $2,000 bill, and not having insurance out of pocket, that was a lot.
I was up at 3:30. We got on the road at 4. We got here about 10 of 5. And I've just been sitting and waiting, listening for my number. I think I'll be in the next group.
We are now calling the numbers up through 235.
Thursday night I came here outside, big line, and then we stay all night here.
Just really great. Everyone here is just calm, waiting to be served, and respect. Everyone's like to have respect for each other.
Actually, I cry when I come inside and I saw all the community here.
They've all been really civil and understanding, right? So there hasn't been any stress.
People are actually waiting around to help you, which never happens in a full-time clinic or a real hospital. In a real hospital, you're left sort of wandering around, wondering what to do.
we're all strangers, and I haven't seen anybody treat anybody negative. Everybody's helping everybody.
And I saw people having a struggling with English and other language, and I tried to help a couple, and it was so amazing. I really want to be part of this.
I don't have a regular dentist because dentistry is very expensive. So I said, well, let me go down here to the clinic. I've been to the acupuncturist, I've been to the chiropractor, I've been to medical issues, mammogram. I mean, the whole gamut of healthcare.
I took 2 days so that I could get as much out of it as I could, and I did. I got the dental, the vision, the foot care, and the medical. Got it all done. It was reassuring, and I'm glad I had spent time to come down here.
It feels good. It feels good to be here and getting those things that I need to take care of, taken care of.
The problem is lots of people don't have insurance, can't afford insurance. So opportunities like this is great for you to come and take advantage of it. And that's why I'm here, and I guess that's why many other ones are here.
A lot of people don't have access to health care or to go to a clinic and be examined, not even once a year. And a lot could happen in a year.
The healthcare, you know, is too expensive, but thanks God there's places like this.
There might be some problems with the system, but at least here there's not a problem with the people. The people all want to help. So I think that says a lot about our community.
How are you today? Good.
These doctors spend all the time in the world because they're not doing it for money, they're doing it from their heart. And that saved my life. And now I'm still here to assist with others.
It's amazing. It's just so much love. You know, you feel like family right here.
There's a community effort, and the people are receiving it. They appreciate it. You could tell. I know I do. I really appreciate it.
I'm also very much impressed with the way we've been handled here from square one up to this moment. I'm thankful.
La comunidad hispana, que vengan, you know, que chequen su salud porque es muy importante. It's very important, you know. It's the more important thing that we got in our life is our health.
This is what it's all about, helping each other. The ones that down, help pulling them up.
We need to help people in our communities and help our neighbors. If we spent more time listening and caring, our world would be a better place.
It's a long day. It's a long wait. But we made sure that people felt that they were cared for and that they were honored. They were welcome. They were included. They were part of a community that we wanted to serve.
They come in, you know, in pain. They haven't seen a dentist in years, and they somehow heard about this through friends or advertisements, and they come in hurting. You can see it on their face. They're tired, they're holding their jaw, you know, and just saying, oh, I'm in so much pain. And when they come out and give me their chart and I cut off their bracelet, they're like, oh, I've been dealing with this for years, and they're smiling and there's no pain anymore.
98% of the patients say the best thing they liked about the clinic was being treated with respect. And they felt that from the first person who checked them in to the last person who checked them out and all the way up the line.
Somebody really wants to know, what are you here for? What can we do for you today? And there's that humanity piece in there. And I think people remember that. They look forward to coming to the clinic.
People knowing that they can come every year to this event and they know what to expect has been, I think, life-changing for a lot of folks.
You know, you're relieving somebody of a great anxiety. You know, they're anxious about their teeth, their health, the pain they're having that they've had.
You're not just seeing medical needs here, you're seeing all kinds of needs. And, you know, people that haven't eaten in a while, people that are homeless, some of them are eligible for health care and they don't understand it.
One of the biggest problems with the way our healthcare system in this country is set up to be so fractured and not integrated, people don't know what to do.
So many patients we come here today are just, that I talk to, are just throw their hands up and they say, it's too complicated, like I don't know where to go, you know, and it's more stressful to try and figure that out than it's worth to me or that I'm able to do, and they just disengage. And so here we see, I think, that opportunity to re-engage.
The pre-stuff that they gave us before coming was very much a charge to be empowered and to empower your patients and to show them that they can be an active part in their own care.
Introducing them into the system itself is the first step then of them being able to access that system on their own.
They're connected with other resources in the community, which is very, very important. A lot of people don't know what their network of free and charitable clinics and federally qualified community health centers and rural health clinics and rural hospitals and, you know, Indian health clinics, what are all those options and how do I access those?
One of the things that I'm most proud of and what the Seattle Center has done is it's the resources and the networking afterwards. So people come in and get the care, and so what? What do they do now?
I actually think that's the most important thing we do is people come here with a problem, but we try and hook them up with ongoing health care.
We don't want them to have to wait every year, once a year to get these services. We want them to get the services when they're sick, or ideally preventative services so they don't get sick in the first place.
Giving people that information and allowing them to have those communications and that knowledge built up for themselves, that they can take control of their own situation to the extent that they can. That's where you want people to be.
This clinic is the physical embodiment of 3,000 volunteers, 4,000 patients, and an incredible amount of planning and a machine that works so well that actually fosters the ability to choose, fosters that autonomy, and gives somebody back a piece of dignity that may or may not have been taken away from them too many times.
This is a place that is able to draw that number of people, and I think the right kind of people. The people who really need that service, who are falling through the cracks, and who know they're falling through the cracks. I worry about the 20 or 40 or 80,000 out there who don't know we're here.
With all the people who don't know what the answer is, but it's just that whole idea of if be part of the solution or be part of the problem, and so it's doing something. It's doing something, and it's something that has such an enormous impact in a positive way for the patients and for the volunteers and for the community.
Everyone needs to feel loved. Everyone needs to feel taken care of, and I feel that we bring that humanity and to in this clinic. People are telling us that we're changing their lives, and you couldn't ask for a better outcome.
When there is respect for everybody, we can do wonders.
I saw humanity at its finest at this clinic.
I think what the Seattle King County Clinic does is it tears down this notion of us and them and presents you with this event where really all that's left is really community.
That is a real strength of the clinic and a real strength of the structure that we built for it, which is it invites people in and it makes them feel whether they are providing services or receiving services, it makes them feel valued.
All of these people are volunteering their time to make a difference, and they care. And so when people think that, you know, nobody cares, just look around. It's here.
It's kind of part of our makeup to want to help, but we don't know where to go or where to do it. And when we see possibilities, they look like they might be harder than we're capable of bringing to the cause. And so by the clinic, we wanted to make it easy. We want to not only give you a place to help, but make it really easy.
It's a real testament, I think, to the Seattle Center and their team in being able to get people to a place where they're able to do what is needed, regardless of their background.
To help with something like this in a community, you can't just walk out your front door and start giving somebody dental care unless you're a dentist. For those of us that aren't medical, dental, or vision professionals licensed, it gives us a chance to connect with the people with those skills at a bigger level and offer that, because that dentist can't do that by himself. So we need all the support people to support them and make sure they can adequately give care to those people.
So you have volunteers from all walks of life that are willing to show up with or without skills, medical skills, but to be part of it.
It's nice to, see what the need is in the community, know that we get to be a part of helping that.
Everybody here is united for the same reason, and it's so great to work with such a group of volunteers that are all focused on the same thing. Nobody has a hidden agenda or something else that's going on. We're all here to help as many people as we can in 4 days.
I always get goosebumps when I come here. This is my 5th year. Kids are at home with their grandmother while we come here to help 4,000 people.
This is not only a valuable service to several thousand patients, but this is an engine that creates a lot of inspired volunteers. And so these people not only see the need, but they get to experience being a volunteer.
Not only is this a place where we bring health, wellness, and healing to someone who needs it, but I believe that there's a restorative quality about being able to volunteer here.
It's emotionally replenishing because I think we don't mind doing hard work if it's hard work with a purpose.
It inspires us every day to remember and think about how we have touched people's lives in a very profound way.
The emotional impact of doing this and being with so many, working with thousands of volunteers, we're all giving time, and I just didn't anticipate that when I started working on this project.
I am an old person. It gets me out of bed in the morning, and I feel so grateful because I know these people needs this care and they can't get it no place else. So I feel like this is important work.
You're serving people in a dignified, human way to where they feel valued, and that's invaluable to me as a person. I guess I'll speak for myself, just to be able to be a part of something like that.
This is one of the greatest experiences of my life. It is just such a pleasure to work with people who are so committed to trying to address the problems that we have.
So it's all about stepping up, not because you have to, but because you want to. Because we recognize that it's not about me, it's about the community.
You walk away feeling transformed and feeling connected and restored in your belief in humanity about what can be accomplished when we all work together.
There's context now to the statistics, so when they hear it on the news or they hear politicians speaking about this population, maybe there's now a different perspective on who is in need.
Before this, I kind of took it for granted. When I got a cold or was sick or needed help, I could just go somewhere and get it, and I didn't have to pay a whole lot of money for it. And it wasn't until I got here that I realized, wow, that is not something that everyone can take for granted every day.
I think it gives all of us, both volunteers and providers, an opportunity to maybe look at how we deal with the world and how we see others, and maybe make a judgment call based on certain things, like looking at a book before you read it.
I think we tend to see people through a veil of judgment. We have certain views about who is who and what that means and what they're like, and we don't really see into the full humanity of people.
We all have biases, and we act on those biases. The best way to moderate those is to examine them and to work with individuals directly.
So somebody might start on the front door checking people in, and in their day up in medical or dental, escorting people out. So they kind of see the whole process as it moves through the clinic, so it kind of makes those connections that it's not just, this guy's homeless. By the end of the day, it's like, this guy's named Jim, he's homeless because these are his healthcare needs.
You're not a set of ideas, or you're not a set of assumptions, or you're not a set of stereotypes. You are the individual across from me that I can see, touch, feel, hear, and experience, and understand.
When we have a community of providers and patients that come together, it really shows us, and we learn from one another, and we learn about what they're experiencing, whether it be economically or socially.
I love it when the volunteers come in and some of their assumptions are challenged, and we break down some of those stereotypes. We break down some of those barriers, and they see people, they see the humanity.
It's broadened my awareness of and appreciation for what other people, the lives other people live like.
It's when you put those pieces together that you really start to appreciate and value what this is.
Having a place to come together and get just that knowledge that the world is not always what it seems, that's fantastic.
There's like 3,500 volunteers here. Now 3,500 volunteers have a much better understanding of what's going on in their community.
We are connecting people with each other, so those relationships go on. So I do think this permanently changes our community for the better.
One of the things about the clinic that is so important is that power of bringing people together with a common purpose and doing something that people feel not only good about, but can see the good in it.
The clinic is an example of how community is layered on top of community on top of community, and I think that's really the real story to tell with the clinic, that our community can really come together when there is a clear goal and that there is an appetite for making a difference.
Where they can give their expertise to something, because it's daunting, you know, it's daunting as a problem, but you've got this opportunity to be a part of something, and it's not just showing the need, you're serving people.
Here's an example of people stepping up, stepping in, arm in arm together, working to make this community better.
When you have an event like the Seattle King County Clinic, it gives people an opportunity to express their belief that that they can do something, that they can matter, that they can make a difference.
It's a change agent. It really is. It helps much more than just the few we help here. All these volunteers, many of them are going to go do something, and that just is amazing impact.
If you come to this clinic and it changes you in terms of how you provide health care, who you provide health care to, what the focus is in terms of treating people respectfully, giving them enough time and so forth, if we can see that that can be done and transfer that into our business as usual healthcare settings, I don't see how that can't be transformative.
It gives me hope that this can still be accomplished, that we can still be collaborative, that we can still be compassionate, that we can still come together around shared ideas and learn from each other and grow something that can be of benefit.
We need to fix healthcare in this country. We need to recognize healthcare as a human right.
We need to come together collectively as a society and decide what is our corporate societal responsibility.
The issue of the health and safety of everyone around me isn't just an empathic, I'm putting your safety ahead of mine. It's recognizing all of our safety is tied together. All of our well-being is tied together.
Once we realize that we as a community rise and fall with how we take care of those who need the most help, we will understand that it matters that people don't have health care.
I've never worked in a place where people have said so frequently with such regularity, like, I was finally listened to. And how do you put a price tag on that? Does our health system pay for that kind of time, pay for that kind of attention?
We want there to be long-term fixes to the system, right? And that this is not the solution here at the clinic, but there are so many people who need it right now. They are living with pain that prevents them from working. And they just need some relief, and until that system gets fixed, I'm really glad that we have this clinic.
The success of the clinic could be a very positive and encouraging example of how we might be able to model healthcare and access on a more regular basis, not just once a year, 4 days out of the 365.
I travel a lot internationally, and I go to countries where I can walk in and get medical care for a couple bucks, and I'm not a citizen. We should have a system in a country as large as ours that can help everybody.
I don't know what the answer is of where we go from here and how we connect this experience with a foundation that builds on a broader solution. But I think it starts with this experience and what we learn from this experience about how people come together and what their capacity for helping their neighbor is all about.
It's not just about the event. It's really trying to have it so that the event is not needed and that you create that level of caring and that level of concern for neighbors and folks who live in this region, not just over those 4 days.
I'm hoping people who learn about this clinic will also think about why is it that people are having to come here? And what is it that we can do so that this doesn't have to happen?
If we could take that same kind of energy and focus that all those organizations demonstrated and really think about how can we apply that great thinking, that great coordination to thinking about long-term solutions.
I've heard more kind of, I'd say, informed and in-depth systemic discussions about what it would really take for everyone to have access to the care that they need when they need it.
To help recognize the sort of unmet needs that are out there and sort of look and say, okay, well, this is where our city, our state needs to continue to push on things to try and make sure that we can continue to serve the patients in the community wherever they may be.
We have to address all those fundamental things that make people feel that they are part of our communities, and being healthy and productive are important to those goals.
We believe that everyone has the right to good health, and that includes looking at upstream factors that contribute to health, such as access to economic opportunity and an education that sets people up for living wage jobs, as well as access to health care.
We're thinking about income, you know, your zip code pretty much determines your health as opposed to anything else. Education level, food security, those are the kinds of things that we're trying to work on in public health so we can put the clinic out of business.
It takes a group of people who are determined to find the answers, who are skilled at bridging differences and finding common ground, who are visionary to be able to inspire folks who haven't worked before to come to the table.
We have to be willing to listen and try to understand one another rather than, you know, try to be so isolated in how we perceive the world and there's only one way of going about this.
But it's possible. We've seen it. We've seen it 5 years in a row in healthcare. And I think doubt is a big inhibitor to action, and we got to believe.
What seems impossible is not impossible, and so I think we should never stop trying for it. I think if you dream small, you get small, so I think we've got to go for it and keep advocating.
The fact that we have a community that historically has worked together, that is progressive, that wants to see all boats rise, I think is our strength.
There is such a strong ethos of equity here, and a sense that we both have a collective responsibility to lift each other up, and asking ourselves at an individual level, what can we do?
When people get involved and work together, this amazing things can happen, and this is proof of that.
This could get us a long way, and how do we create opportunities for us to do that, where you don't have to be of this persuasion or that. All you have to be is willing to help and willing to work with others to make something happen. We need more opportunities like that as a people.
They're about community, and it's about commitment, and it's about passion, and people wanting to be invested in that and have a better world to live in, not just for themselves, but for their family and their neighbors. And it would be great to increase the participation in that.
If a few Band-Aids are going to solve a few problems, we're going to keep doing it. And when they solve the system, which God help us all, I hope they do, we're going to be really happy to go out of business.